Hi everyone, welcome to the first episode of the Health Tech News brought to you by Medics in Tech. My name is Glory and I'm super excited to be your host for this Health Tech News. So if you're someone like me who loves the health tech industry and would love to be updated about how technology is improving good health and well-being all over the world, then you should like this video and subscribe to this YouTube channel. On today's episode, trust me when I say I have interesting updates for you. So let's get into it. On the 12th of February 2025, Apple launched a health study which is now available through the research app. Someone is probably wondering, why would Apple launch a health study? Well, the aim of this study is to further understand how technologies like iPhone, Apple Watch, AirPods can play a role in advancing and improving physical health, mental health, and overall well-being. That will take us to why this health study is important. In medical research, discoveries are often limited by the number of participants recruited, the amount of data that can be captured, and the duration of a given study. But Apple has been able to expand these possibilities. Let me help you understand this better. The Apple Health Study builds on learning from the Apple Women's Health Study, the Apple Hearing Study, and the Apple Heart and Movement Study. Now, all these studies in combination have over 350,000 participants across the US. It means that researchers can now have participants for their studies. Also, this health study will help researchers to detect, monitor, and manage changes in health. A health study can help researchers to understand how your mental health impacts your heart rate. Now you know why this is important. Interestingly, there have been numerous positive comments about this health study. And one of them is from Callum McRae, a cardiologist professor of medicine at Harvard Medical School and the principal investigator of the Apple Health Study at Brigham and Women's Hospital. Before I read his comment, this health study was done in collaboration with Brigham and Women's Hospital. Makes sense, right? So, his comments. We are excited to be part of the Apple Health Study as it will continue to explore connections across different areas of health using technology that so many people carry with them every day. So, if you are using Apple products like the Apple Watch, AirPod, or iPhones, you are likely to be able to access this health study. However, this study is currently available in the US for participants that meet the age requirements and that completes their informed consent form. So if you're not in the US, you should expect it to get to you soon. But the exciting thing about this study is if you have access to a digital device, then you can be part of a research study all over the world. Isn't that amazing? And that's it for the Apple Health Study. Now, let me take you right into the second thing I have for you today. In this second news, I will be profiling a startup that is making wave in the health industry. The name of the startup is Telemedan. Well, I hope I got the name right. What does Telemedan do and which of their innovative solutions will I be profiling today? Let's get right into it. Telemedan is a chat-based startup founded in 2021 that addresses healthcare access challenges in underserved and remote regions. One unique thing about this startup is this. They provide innovative solutions for rural communities. Now, I have two unique innovations they've been able to create. One is a solar-powered telemedicine kiosk. These kiosks are equipped with stethoscopes, ECG machines, and ultrasound probes. These kiosks also include teleconsultations, allowing patients in those rural areas to consult healthcare professionals. The second innovation from this startup is a USSD based mobile application. What does the USD application do? It allows users to schedule consultations with healthcare professionals and also access health information without internet access. You will agree with me that internet access is a problem in rural communities. So, for this startup to bring an innovative solution where patients can access health information and get treated without internet access is simply innovative. And of course, there has been exciting feedback from the patients and the healthcare providers. And this startup has received high demand for their solutions. According to Abaka Mahamat, the CEO of Telemedan, our kiosks have seen consistent use in rural areas. The teleconsultation service is rapidly being adopted in regions with poor access to specialists. I love innovative solutions that are sensitive to the environment, and that is why these innovative solutions get a 10 over 10 from me. Another interesting thing is that this startup has received grants and collaborations with big organizations like the Ministry of Health of Chad, the BJKD Foundation, the UNDP, and the World Bank. That's it for Telemedan startup. So, did you find Telemedan innovations interesting? You should definitely check out what they do. Now, to my next update for today. A study titled Leveraging Research Prioritization and Emerging Technologies to Strengthening Healthcare Delivery in Africa was launched on the 14th of February at the 38th African Union Summit in Addis Ababa. When we were busy doing Valentine party on the 14th of February, these health leaders came together looking for solutions to healthcare. Where were you? Okay, let's go back to the news. Present at the summit were leaders and experts such as Malawi's Foreign Affairs Minister Nancy Tembo, AFIDEP Executive Director Dr. Elias Zulu, and Chairperson of the African Union High-Level Panel on Emerging Technologies, Prof. Yaye Gazama. I hope I got that correctly. Let's get right into why this health study was launched in the first place. This study covered key technologies, including AI and blockchain. Why do we need these technologies? The aim is to reduce the deaths caused by malaria and also to improve maternal and newborn health. I really want to see how they're able to use these technologies to achieve the aim of the study. Alright, the last episode I have for today. Again, I'll be profiling a startup called RecoMed. RecoMed is a startup in South Africa that is revolutionizing how patients access healthcare professionals and healthcare services. Now, how do they get to achieve this? Let's say you got a drug prescription from your doctor and you need your drugs to be delivered to your house. All you have to do is go to RecoMed platform to submit your drug prescription and have your drugs delivered to your house. Easy, comfort. Another unique thing about this startup is the fact that they have been able to recognize that there are over 2,000 pharmacies in South Africa, and they've been able to leverage this advantage to ensure that patients can now access general practitioners through pharmacies. These pharmacies are expanding their services to include family planning, immunization, chronic health management, and general wellness checkup. So, if you are in South Africa and you need to access a general practitioner, all you have to do is go to RecoMed platform and look for the nearest pharmacy to you. In that pharmacy, you will be able to access all of these services. Also, if you don't want to visit the pharmacies, you can book a virtual session with your consultant and have your healthcare taken care of. I'm a huge fan of any innovation that is easy and comfortable to access. And that's why this startup is getting a 10 over 10 from me. The fact that it's in South Africa, well, maybe if I get to travel to South Africa, I'll be able to access this. But here in Nigeria, I believe that there are other startups that are doing things similar to this. And in subsequent episodes, we are going to be bringing more of this startup. Thank you so much for staying till now. I would like to get your feedback for this news. So leave a comment telling us about your favorite part of the news and also which of the startups are you going to follow? All right, everyone, and it is a wrap for the first episode of this health tech news. I remain Glory. I hope you enjoyed the episode as much as I did. I will see you in the next episode. And till then, bye. Yeah. If you're yet to subscribe to this channel, do that now. Do that now. It's not gonna bite.